morning, students.
Good morning, sir.
Today we will discuss the new chapter, care of newborn. And in this, the first topic is essential newborn care. What does this mean? This means that the newborn care starts from the onset of pregnancy. It is not that once the child has delivered, right in the antenatal period, the newborn care starts. How it will start? If you are giving good quality antenatal services to the mother who is pregnant, at least 4 antenatal checkups are needed, and these checkups they include, as far as the protocol, all tests, all investigation and all physical examination of the mother should be done. Second is the safe delivery. This means the delivery should be already decided where the mother wants to go for delivery, and it should be, the place should be appropriate for the type of delivery she is expected. Let us say if the obstetrician has stated that delivery will take place by mode of LSCS, lower segment cesarean section, then the appropriate hospital where facilities for LSCS are available, that should be already chosen, and the gynecologist should be aware that this patient will be coming to this hospital. Secondly, if there is, say, 2 twins or some difficult high stage, it should also be planned so that delivery is safe. This means that this optimum care at birth. At birth, the child who is born should be able to get an optimum care. The person who will be receiving the baby and attending the child during neonatal resuscitation, he should already be trained in this. Then, fourth is promotion of exclusive breastfeeding. This means that the mother should be motivated right during the antenatal period that she has to give her feed to the child immediately after birth. And the staff who is present in the hospital, it should also encourage breastfeeding right after birth, within half an hour or maximum within 1 hour. Sometimes what happens, we have seen that for convenience, because no one wants to spend more time on the mother and child, they will say just bring 1 powdered milk and give it to the child, and then you can start the breastfeeding, which is totally wrong. Only the exclusive breastfeeding right from the beginning of birth should be given. Then the steps should be taken for prevention of hypothermia. The fan should be off, and it is not that the child is left uncovered, he should be dried. We will take up all these topics when we will discuss the neonatal resuscitation. And bacterial infection, this is also very important. Bacterial infection to the child should also be avoided. Now, newborn care can be of 3 types: level 1, level 2 or level 3. The level 1 is in 80% of the delivery, you will be expecting only level 1 care. बहुत सारे बच्चे हैं जो डिलीवरी हो गई, they are in the full term range, weight is good and cries instantaneous, they don't need much care except the level 1 care. So these are the children more than 1.8 kg, more than 34 weeks gestation. So this level 1 care can be given at subcenter, this is SC subcenter, PSC primary health center, or even at home. Though we do not encourage home delivery, but if the mother is discharged, then this level 1 care can be continued from the institution to the home. Then the proper warmth to the child must be provided. This is very important. You must have seen if you take a bath and then come under the fan, you will start feeling shivering. The same happens to the newborn child. It is totally wet, and if the ambient temperature is low and fans are AC are on, then the child is likely to go into hypothermia, which is a danger sign for the child. Asepsis. Asepsis maintenance is very important to avoid any bacterial infection. Then exclusive breastfeeding. Trained birth TBA, trained birth attendants, they who are trained, they should be available for the level 1 care. It should be level 1 care should already be, training should be given to the TBAs if the doctor is not available round the clock. Then what is the level 2 care? It will be needed only in 10 to 15% of the cases. And this level 2 care, it will be needed where 1000 to 1500 deliveries are taking place per year. Where the delivery load is more, then you must have this level 2 care in that hospital, because you will not be able to refer all these cases. They will need care immediately after the delivery. So level 2 care should be present in such institutions where the delivery load is high. It will be needed for newborns who are 1200 to 1800 grams and gestation 30 to 34 weeks. It can be given at first referral units. Let us say if the delivery takes place in a PSC where level 2 care is not available, then first referral unit or district hospital. There also level 2 care is provided. Then teaching institution, for example medical college, they also provide this level 2 care. Here in the level 2 care, what is needed? Equipments for resuscitation. They are available round the clock. Then thermoneutral environment for the child in the level 2 care. Facilities for giving IV fluids and NG feeds. NG feed means nasogastric feed, also known as gavage feed. Facilities for phototherapy in such units is also needed, because some children they will go into neonatal jaundice, and if the jaundice goes beyond the parameters, then exchange transfusion may be also needed. So exchange transfusion facilities, they should also be available, though the incidence of exchange transfusion has decreased these days. Then the basic needs, they are also very essential in such units. The space should be separate and it should not be congested. Sometimes what is done, that a small corner of the ward is taken and declared that it is a level 2, which is not correct. It should be a separate room with separate nursing staff and separate manpower and with proper all aseptic facilities. So then we come to the level 3 care. What is level 3 care? This is needed in small percentage of cases, especially those which are less than 1.2 kg or less than 30 weeks, or those who are high risk, or they are born with some ailment at the time of birth. For example, birth asphyxia, meconium aspiration syndrome, some congenital abnormality. So for all these conditions which a newborn child can have, this level 3 newborn care will provide all the essential services to the newborn child. These are some of the apex institutions which have got the level 3 care. In all hospitals it is not available. Because why it is not available? Because the capital and capital expenses to establish a level 3 care nursery. The capital cost is very high. Not only the capital cost, but the recurring expenditure. What does it mean? Recurring expenditure means daily expenses. हर रोज का कितना खर्चा है वो भी बहुत होता है, इसलिए these are available only at apex institution. What is needed there? Central oxygen supply, central suction, then servo controlled incubators, vital signs and transcutaneous monitors, ventilators they are needed, especially infantile ventilators, infusion pumps, skilled nurses. It is not that any nurse you can post in the level 3 nursery. It is only those nurses who has got specialized training in NICU, they can be posted in level 3 nursery. Then neonatologists should be available round the clock on call. Then they should have sound infrastructure. Optimal neonatal care facilities already in place. What does this mean? That already these infrastructure, manpower and this costly and sophisticated equipment, it should already be there. Sometimes what happens, they plan and buy a few things only, then they decide that if need be, then we will buy this. It is not like that. You have to be available, make available all these sophisticated gadgets and neonatal equipment right before you plan to start the level 3 nursery. So this is all about this neonatal care. Thank you.